Hi, we're a teammate and we're designing an IV infiltration detection device. IV infiltrations occur among 20% of pediatric patients, and our device is working towards early detection. This device focuses on three main components: dual sensor technology, line detection algorithm, as well as a streamlined dashboard, which will go into more detail throughout the video. Here you will see our dual sensor technology being tested on a pig liver. This focuses on both the use of a thermal camera sensor as well as a flex sensor. The thermal camera sensor is used to detect temperature change once the IV is injected into the patient. The dashboard here shows the change in color once the IV is into the patient. We have a line detection algorithm that will show the line of the IV on this dashboard. This is shown, as seen in this video, in blue. We can determine an IV infiltration once we can no longer see this blue line, which shows that liquid has now entered the patient's vein. This data is then transmitted onto a user dashboard that can be used by nurses to help determine if an IV infiltration has occurred or not. Here you'll see our flex sensor data. Once the skin has changed in stretch, this data will be shown on the graph below to help nurses determine if an infiltration has occurred or not. Again, this will be transmitted onto a dashboard.
The dashboard is designed to be easy to use and easy to read for the nurses. It displays when the patient is at risk of infiltration and when they have most likely undergone infiltration. If the nurse wants to further inspect the data, they can look directly at what the sensors are reading and come to a conclusion themselves. We plan to target three primary markets: ICU prevention, chemotherapy patients, and NICU patients, as they provide the most impact.
Over the next few months, we will finalize our device design and gain approval by the CHOP and HUB team. Thank you for your time.